Hi, welcome to Reset Your Mindset by LifeStance Health. Myself, Dwight Thompson, and my co host, Nicolette Lienza, will bring you conversations with leading LifeStance Health professionals who will help guide you on your journey to positive mental health and well being. At LifeStance, we believe in the three pillars of mental health: mental flexibility, mindfulness, and resilience. Welcome, everyone. Thank you for joining us again and tuning in to the LifeStance Health Reset Your Mindset podcast. Today, we are really excited to have first-time guest Stephanie Phillips joining us, along with a voice that you have heard on this platform before with Dr. Omar Elhaj, our Division Director of Special Projects. So Dr. Elhaj, welcome back, and Stephanie, welcome to the first time. We are thrilled to have you. So Stephanie, before we get started here, would you mind telling us a little bit about yourself?
Sure. Well, I am a licensed independent social worker in the state of Ohio. I also have my license in Kentucky. Down there, I'm considered a licensed clinical social worker. I've been practicing for about 9 years now. My special focus, I guess I would say, is on trauma. So the therapy modality that I use most frequently is eye movement desensitization and reprocessing, which is known by the acronym EMDR. I also, because of my specific training and the company that I went through for that, I have a mindfulness focus. There are various focuses with EMDR depending on your specific training program, and mine happens to be mindfulness based. Mindfulness principles really dovetail nicely with EMDR in terms of maintaining present awareness and meditation and those kinds of principles. So specifically, I have specific training in perinatal mood and anxiety disorders. So kind of colloquially known as postpartum depression. So postpartum depression and anxiety. Because of my trauma training, I actually have a special kind of niche focus and interest in specifically birth-related trauma. Yeah, I graduated from the University of Kentucky, so I started my practice down in Kentucky, and I've been up here in the Cleveland area for just about 2 years now.
Awesome. Thank you for sharing. You certainly
Yeah,
work with a very specific population and
yeah.
some incredible work. So we're thrilled to have you. And so, Dr. Elhaj, for those that maybe not have heard you on this platform again, we're really thankful that you joined us again. Tell us a little bit about yourself, please.
Thank you, Dwight and Nikki, for having me. This has been a really
Welcome.
wonderful medium the two of you have created to help us spread the word about wellness, about resilience, especially in this era of traumatic change during the COVID-19. So kudos to both of you.
Thank you.
I'm a psychiatrist by training, specialized in addiction and geriatric care, and my passion is for working with people who live with a dual diagnosis. Worked in the VA for about 5 years, and this is where my interest and learning curiosity began with post-traumatic stress disorder, and then that started to grow more into not just militarily based trauma, but traumas that can happen across the lifespan at any aspects. I'm very glad to actually be teaming up with Stephanie today, because I cannot wait to hear what she has to say about all the traumas that a lot of people dealing with, and how we can convert that into positive. So thank you again for having me.
Yeah, our pleasure. And Dr. Elhaj, as always, thank you so much for just some of your backgrounds. So today we're going to be talking a lot about post-traumatic growth. You hear post-traumatic, probably the first thing you want to say is stress disorder. But today we're actually going to talk about post-traumatic growth. So Stephanie, we'll start with you. What is post-traumatic growth?
Well, post-traumatic growth is a really interesting phenomenon that's been observed over time. And it just basically, in a nutshell, kind of refers to this idea or this observation that people have had over the years that sometimes in the wake of trauma, whether that's kind of a more single incident trauma that we think of, kind of an assault, a really bad car accident, something that kind of threatens life and limb, or whether it's maybe something that is kind of a more complex trauma, a trauma event that kind of extends over a greater amount of time, that actually in the wake of enduring some kind of trauma, we actually see people who function better in the wake of that trauma, that they come out of it kind of stronger in some way and just grow. Yeah. I mean, post-traumatic growth is it's right there in the name, just that growth, that kind of better level of functioning or higher level of functioning that we see after people have endured something that is very, very traumatic and difficult and challenging.
Yeah.
And this is a good leeway into what we've been going through currently with COVID, right?
Yeah,
I think
definitely.
we can collectively say that this has been traumatizing on many different levels. So it makes sense that we'd be pairing post-traumatic growth with COVID and how to navigate this, right? And,
absolutely.
And this is where this episode will talk about the good that can come from this and everything.
Right. So. Yeah. Yeah. And I think something like COVID-19 is interesting in the sense that it's this kind of collective trauma experience. We're kind of all enduring this big event together. Of course, all of our different experiences, depending on what we're going through. Some of us have lost jobs, some of us are still working. Some of us are, like in the instance of the class of 2020, whether we're talking about high school seniors or college seniors, some of us are losing these kind of milestone events that we've been looking forward to for years. Some of us are, we're kind of more living our regular life with kind of relatively mild adjustments. Some of us are working from home. Some of us are still working in grocery stores or working in hospitals. So it's interesting to me that we're all kind of enduring this collective trauma. And so, but at the same time, we're all having a very different experience of it. And it looks different for all of us.
Very true. Thank you, Stephanie. Dr. Elhaj, please share with us your thoughts about post-traumatic growth.
I couldn't agree more with Stephanie. The concept of post-growth from a psychological perspective and academic perspectives, been talked about probably for the past decade or so. It started in the University of North Carolina in Charlotte. But when we look at, humanity and religions and mythologies, across continents and cultures and millennia, the concept that pain and suffering and struggle can spur growth and improvement and advancement has been as long as human existed. They actually have looked at factors that can enhance and nurture that. And one of them is actually spirituality. The other one is social support. But some research actually shown that there is a neurobiological aspects to that. Especially in terms of how some people respond differently to the stress in the hypothalamic pituitary adrenocortical pathways in the brain. So this is really an all-encompassing experience, and I would love to, hear more from Stephanie about how has that been, observed in the actual patients that she has seen in the past few months now.
Yeah, one interesting thing that I seem to notice from my clients is the people that whether I've been seeing them for trauma or whether I was just seeing them for kind of more generalized anxiety, is that they seem to be functioning better in the wake of all of these changes. And the interesting thing to me is, at least how I interpret it, is that is kind of a sign of the resilience the type of resilience we see with post-traumatic growth. People who they've kind of put it in terms of, like, welcome to my world where I have anxiety, kind of the rest of the world that maybe hasn't struggled with anxiety, hasn't had problems with trauma, are kind of now getting some insight into, according to how they feel, getting some insight into how they feel all the time. And so they seem to be functioning better. They seem to be handling things. And I kind of chalk it up to that resilience that does come as a result of whether it's trauma or just kind of the skills that you need to build to kind of navigate your way through a world where you feel anxious and you feel like there's a lot of threats around.
Mm-hmm.
And building that resiliency and building those coping skills to kind of manage through life with anxiety or life with trauma symptoms. And so I think that really speaks a lot to post-traumatic growth, you know, as a concept, is that they're able to know how to navigate this.
Stephanie, your points were very poignant, and you're right. It does speak volumes to the strength that individuals have during this time and during trauma in general, and sort of what people are capable of. But one thing that was repeatedly mentioned was sort of the buzzword that you hear frequently, which is resilience. And Stephanie, you touched on that quite frequently. Resilience and post-traumatic growth are thought of often as synonymous, but there is a difference that lies between resilience and post-traumatic growth. What would one say to the difference that is there and how they are not necessarily synonymous?
So let me jump in there, because one of the ways I define post-traumatic growth is the meaning we make to our trauma. It's the lessons we learned, and also the meaning and the purpose it was in our life. And I separate that from resilience in the fact that I see it as like bouncing back. It's how you bounce back is what I see resilience as. So it is two separate things, but they definitely interplay together pretty well.
Sure.
So one is the bouncing back from the trauma, but the other one, as you bounce back, is looking back. What is the lesson learned? What was the meaning that came out of that trauma, which is so key with post-traumatic growth. So that's how I personally would define and differentiate the two, for sure.
So, during trauma, people have the tendency to view themselves as weak, whether it's during the trauma or after the trauma. And it's so important to have the outlook on yourself and sort of the introspection to see yourself from a strength-based perspective. Stephanie, what advice would you give to someone when it comes to reframing the way you're viewing yourself during trauma?
Well, I mean, I think speaking of the whole concept of resilience, sometimes that is, or often, I guess I should say, that is one thing that a lot of people can kind of find solace and find the starting point for post-traumatic growth, is just from that simple fact of, I went through this life-altering, sometimes life-threatening experience of this trauma, and I made it through. I'm still here. I survived this huge trauma.
Sure.
And I mean, that is no small feat. The fact that we are able to survive, and sometimes when we are in the immediate aftermath or the immediate wake of it, just being able to get out of bed, being able to put one foot in front of the other and continue on, and certainly, reach out for support, reach out for help, whether it's just from friends and loved ones or whether it's from an actual professional, whether it's seeking therapy. I mean, that shows an extraordinary amount of strength and courage to just say, I got through this. And a lot of times that in and of itself can be really healing, to just have that recognition of, this is something that I can survive. This is something that didn't break me and didn't, might have slowed me down a little temporarily, but it didn't stop me.
And often what I find is that people don't realize how strong
Right.
they are. I think sometimes when they do come out of it and you help them reframe it, of like, look at that, you're stronger than you thought you were. And I think that's so key of the reframe of, you're stronger than you were, or you made it through, look at that. I think those are all key reframes to help someone really look at that trauma. Even in this age of COVID, and looking at it, how as a society, and I think this is still yet to be determined, of how we're going to continue to navigate through it and out of it, and lessons learned and stuff like that about pandemics. Hopefully we don't have another pandemic, but lessons learned from this pandemic to hopefully prevent the next one too.
Nikki, I could not agree with you more. I mean, especially about our country and our society. I mean, look at the trauma of the World War II and what we have done through and post of it. The largest industrial expansions, the largest college education that we've ever had. So as a country, we know how to convert a trauma, a tragedy into an opportunity for growth and to really expand our horizon. So I have no doubt that we will be better off, post COVID-19. And one of the things that I actually, talk to, my family, to you guys as my colleagues and to my patients is that with all the challenges that we all have faced, I believe that the silver lining that we have all existentially experienced in this trauma has been a growth enhancing and a tremendous opportunity to, in a way, stop time and think about what really is important to us.
Yeah.
I mean, unfortunately for the majority of us, we've been so busy with life running and running and running. And a lot of times, putting important things on the side because we always convince ourselves that we don't have time for it. And now with this, trauma has allowed us the time to stop and to think and to reevaluate what is really important in our life and what is not. So I have no doubt that individually and collectively as society, we will actually find a tremendous opportunity for post-traumatic growth out of this. So I am, to be honest with you, very optimistic about where we're going to be going in the future.
Wow, I love it. And it actually speaks directly to something Stephanie alluded to early on in the recording is the mindfulness piece that I know, Stephanie, you work on and you encourage so much. Stephanie, let me ask you this. History does repeat itself. We're aware of that. Dr. Elhaj just gave plenty of examples for it. Can you prepare for post-traumatic growth?
I mean, I think you can prepare for the unexpected to an extent. One phrase that has really stuck with me is a phrase that it was originally apparently in the movie from the 1960s, Zorba the Greek, where he talks about the full catastrophe of life. And John Kabat-Zinn actually used that for one of his book titles called Full Catastrophe Living. And so the whole concept is this idea of bad things are going to happen in our lives, good things are going to happen in our lives, and kind of embracing it all and saying, okay, I'm going to take the good. I'm going to kind of sit with the good. I'm going to enjoy the good. When the bad comes, I'm going to sit with that as well. And I'm going to recognize that it's going to pass. Things are going to get easier. It may be really, really hard to see that right now. Things are going to get easier at some point. And I think just recognizing that and kind of rolling with that kind of sense of kind of like waves on an ocean, sometimes things are a little calmer. Sometimes things are a little more peaceful. Sometimes things are a little more rocky, but just kind of embracing the idea that bad things are going to happen, good things are going to happen, neutral things are going to happen. And I can handle it. I can just take it as it comes. I think that's where we're able to kind of prepare, so to speak, and leave ourselves open, like Dr. Elhaj was saying, leave ourselves open to that idea that something positive can come out of things, and sitting with the difficult emotions when they come, but also recognizing those positives, having more time to do things that we might want to do and being open to just whatever comes along. I think that's how we prepare.
Stephanie, wow, that was amazing.
Yes,
very well
well
put. Thank you. And Dr. Elhaj, Stephanie, thank you both for joining us today and imparting your knowledge on this really interesting and important topic of post-traumatic growth. And you both, through your work with your own patients, I can see are just such meaning makers to them. And I definitely appreciate the work you do with your patients.
Thank you.
Absolutely.
Thank you, guys. Keep up the wonderful work.
Wow, Dwight, this was an amazing episode.
Yes, it was.
Gosh, we could definitely talk to them all day, Dr. Elhaj and Stephanie, for sure. I think a few of my takeaways are how applicable post-traumatic growth is during this time of COVID and all of us navigating it, and how key it is to grow from this, use our coping skills as we're navigating it, our mindfulness skills, and also what meaning we can make. And I think that's the key to the post-traumatic growth. What about yourself?
Yeah. So, I mean, for me, it's honestly pretty simple. You're right. We could have talked to them all day. They were just a plethora of knowledge. I got to be candid. For me, it was pretty simple, and it sounds so cliche, but Stephanie just reiterated it. This too shall pass. I know that we've had a few episodes where we're talking. Our discussion is centered around COVID-19, but it is important to be mindful of the climate we're in. And I felt like this episode did a great job of showing that this too shall pass, and there is some optimism to be had. And I just thought Stephanie and Dr. Elhaj had some very poignant words about post-traumatic growth and the strength that lies within us. It's just a matter of tapping into it.
Yes, for sure. Can't agree with you more. That's for sure.
Thank you, everyone, for listening. We really appreciate you tuning in to the Reset Your Mindset podcast by LifeStance Health. Our podcast can be found on Apple Podcasts, Spotify, Stitcher, Anchor, or wherever you get your podcasts. On behalf of the entire LifeStance family, we wish everyone good health and safety, and until next time.